September 1st, 2019, an important new birth date in the state of Connecticut, separating the big kids from the little, who can go into kindergarten and who will not.
She's really excited because I think she's so bored at home.
Connecticut will now fall in line with most other states with the new age cutoff. The biggest reason, professionals say 4-year-olds aren't usually emotionally ready like 5-year-olds.
Or there's kids they don't know and bigger classrooms. It's hard. It's hard for them. You have to be ready to be able to do that.
Julie Bostrom is a preschool director at the Children's Museum in West Hartford. She says they're changing classrooms a bit, adding a class with almost 5-year-olds who before the new law would be headed to kindergarten. Now, these kids will be doing what's considered redshirting.
They had been with us for all these years, and we didn't want to say, great, you don't have a spot. So we had to be really creative. And the biggest thing with parents was, is my child going to be bored?
This early learning center, like many others, will have to shift the curriculum to accommodate children who have already done 2 or nearly 3 years of preschool learning. Bostrom discovered, like many preschool directors, she was navigating an enrollment puzzle.
We thought there were spaces in the classrooms for the upcoming children. Starting in November, people were calling to get spots.
Not all the Burr babies will stay back, and districts are required under law to offer a waiver or kindergarten readiness assessment.
She's more mature for her age compared to other kids.
Anita's daughter was born September 9th.
Oh, we're just there by a few days.
She decided to go through the West Hartford Public Schools assessment process.
If they prepared us a year ahead of time for the bill to pass, then parents would have been a little bit less nervous about this whole situation.
The Connecticut Project ran a survey of superintendents. It found 87% of superintendents believe the state should do more to support early childhood education overall, and 53% wanted the age change to go into effect next year to give them more time to plan. Overall, the report found districts have had to spend time and resources updating policy or coming up with new assessment tools.
Policies varied really across every district in the state, so every town was left to its own devices.
According to data from the Office of Early Childhood, 9,000 Connecticut kids are affected by the change. Half of those kids come from low-income families or families who lack access to critical resources.
Essentially what it meant was adding stress to a system that was already stressed, adding stress to parents, adding stress to early childhood educators who already might not have had enough slots for kids to begin with.
Thousands of families wanted the legislature to delay the rollout, but that didn't happen. Many of those families argued they weren't given enough time to save money and now would have to pay for another year of school,
which in our state can cost somewhere between $13,000 and $15,000 per year for one child.
Many parents are having to take a step back, think a little more critically about whether their Burr baby is actually ready for kindergarten. Bostrom says every child is different.
I look at it as another year to give, let them be a kid. And it's kind of better now to hold them back now. If you're unsure, then later.
The American Academy of Pediatrics says to assess school readiness, parents should look at their child's development and discuss milestones with a pediatrician and their preschool teacher. But also, the AAP says it's about trusting your gut and thinking ahead to the future.
Do you really want your child going off to college when they're 17?
Kindergarten, a big childhood milestone.
Guys, kindergartners, help them out. Here we go.
A major learning leap for a 4 or 5-year-old. And Connecticut schools, too, will have some learning to do, perhaps awkwardly, forcefully settling into this new policy.
I think now that it is a done deal, it's really on the state to keep stepping up for children. The child care crisis is not going to go away, and things like this can really add to it.